Hi everyone, welcome to JoJo's Journey. My name is Joanna and I am a first-time YouTuber. This is the first time I'm doing this, so bear with me if it gets a little awkward. I want to start out by saying that I'm going to be having a procedure coming up. This is the purpose of my journey. I have been watching other YouTubers and their channels and information that they give, and it kind of helps with what you can expect to look forward to. So the procedure I'm having done, it's going to be a tummy tuck. I decided to have this procedure because I have a 10 and 11-year-old, and you know, I've exercised, I've lost weight, and there's just things with my body that I'm not comfortable with, that I just feel like exercise and dieting just won't fix. So that's why I'm interested in this procedure. My procedure is the tummy tuck. It's scheduled for June 11th, so it's about 30 days from now. I'm going back to the same doctor that I had a breast augmentation with about 2 years ago, and I was very happy with my results. Again, it was a procedure that I wanted to get done for myself. After having 2 kids, your body just sometimes doesn't snap back to what it was before. So it's just a self-improvement for myself, things to make me feel better about myself. And I kind of just wanted to do this channel so I can help ease the anxiety for other people who are interested in this kind of a procedure. A lot of the other channels or YouTube videos that I've seen about the tummy tuck, they give great information. There's just so many different kind of experiences, and it's depending on the person, you know, on what you can expect to get out of the procedure. Some people, you know, talk about their pain, and some people seem to bounce back pretty fast. So I did have, with my breast augmentation about a year ago, my recovery wasn't that bad. Like the first 3 or 4 days was probably the worst. So I feel like this one, it's going to be a little bit more intense just because it's probably involving a bigger part of my body, which I'm okay with. I know that, you know, in the first few days, it's going to be the worst, or the first few weeks, it might even be terrible, but we'll just see what we have to look forward to. I want to also kind of give the medical aspect behind the procedure as well, just because I am, you know, a medical professional, that I just want to be able to provide that as well, because from the videos I've seen, that was kind of what was lacking for me. So next week, I have scheduled what's called the pre-op for the blood work that they're asking me to do prior to my procedure. I am going to have a CBC, which is a complete blood count, and a complete metabolic panel. The CBC is to make sure that I'm not anemic, so that when I have the procedure, losing blood is not going to be an issue. And then the complete metabolic panel is checking what my electrolyte and sugar levels are, making sure I'm not, you know, crazy diabetic before I go into this procedure, because that affects healing. So that I have scheduled for next Friday. And then I'll share that with you guys as well. And then May 29th, I think it's a Friday, that is my actual pre-op consultation appointment. So I'll go in, ask my final questions with the doctor, and then after I ask my questions, he'll probably write me prescriptions for pain and whatever else. And then I have my surgery scheduled. It's a little weird timing right now with this whole pandemic going around. So they're actually going to be doing a COVID test on me when I go in for my pre-op on May 29th. So I'm going to have to really make sure that I self-quarantine and make sure that I'm not exposed to anything, because obviously if I end up positive, then that's going to affect my surgery date, and I won't be able to have my surgery if I do end up positive. So if that happens, then I'm going to delete this video and hope that nobody's seen it. But keep my fingers crossed and hope that doesn't happen. So again, this is my first time being on YouTube and posting these things. Again, what I hope to share with you guys, whoever decides to watch, is just to ease your anxiety for any future surgeries that you guys plan on, having. I want to give my medical knowledge behind, what I can as well. So that's about all I have for you now. And then I'll probably see you again in next week when I get ready to go do my blood work. All right, thanks. Enjoy your Sunday. Happy Mother's Day.